I'm about to say some things about nursing that no one wants to say out loud. Let's just jump into it. Nursing does not have to be a passion. It could just be a job, and that's okay. For a lot of people, it's like if they say, oh, it's just a job to me, then people judge them for that, and that's not fair. Look at this economy. It's rough out here, okay? And especially after the pandemic, I think that we all came to the realization, like, what are essential jobs? What are essential workers? So it's okay if your backstory isn't, oh, I want to be a nurse because my mom was sick when I was 5. Or my story, for example, my example would be, I want to be a nurse because my mom's a nurse, my great-grandma's a nurse, and I love the medical profession. Like, it doesn't have to be that, and that's okay. My point is that I don't come from a judgmental place. You do you. As long as you're doing your job right, that's all I really care about. So going off of the whole nursing doesn't have to be your passion thing, I think that it's the perfect job for the indecisive person. Okay, so hear me out. I know it's really like medications, patients, blah, blah, blah. But in all actuality, if you don't really know what you want to do in life, but you're still open to like the human body and biology and pharmacokinetics and all those types of things and pathologies and all of that, then nursing is for you. Because you can literally work with babies. You can work in the NICU, neonatal ICU, or you can work with elderly people who are like dying, like end of life care. You can literally do anything, and I mean anything. Okay, we have so many different specialties, and you can hop from specialty to specialty to see whatever you like. For example, emergency room nursing, right? If you like the fast-paced hustle and bustle, all of these different like cases, and it's really a skill-based nursing, it's really amazing. Or there's med surg. If you want that nice foundational nursing, you get to see everything one by one, and it's hectic, but it's not as hectic as the ER, like hello. Or you got the ICU. You get like what, 2 patients, maybe 3 patients max, and you're following all these different drips. I have a few ICU friends who talk to me about, oh, the drips and the map and the ICP and all these different things. Like, it's interesting to them, and they are obsessed with it. If you like kids, you can do pediatrics. There's so many things. And then there's like nurse research. You can get into research if you want, and you don't really have to work with patients directly either if you're not really like a people person. If you want to work at a school, be a school nurse. You know what I'm saying? Like, the options are literally endless. So yeah, nursing is great for the indecisive person. This one, I don't know if people are gonna like this one, but honestly, guys, this is my opinion. I feel like you can quit, and that's okay. Like, calm down. I remember when I was in nursing school on one of my first clinicals with my professor. She was absolutely amazing, and she told us, she was like, guys, if you are working in a certain specialty or a certain place and you feel like you genuinely do not like it, or it's coming to a point where like you're getting resentful towards your job to a certain degree, just quit your job. Because the number one thing in nursing is patient safety, right? And we've seen we've seen stories where nurses go off the rail and they do stuff that they're not supposed to do, or they hurt a patient, or all those types of things. Do not do that, okay? If you feel overwhelmed, if you feel stressed out, and you do not like your job, or maybe you want to try something else, because again, I just said there are so many different specialties out there, just maybe not quit like the whole facility if you can, but maybe just go to a different unit. There are so many units in a hospital. There's ICU, there's PICU, there's NICU, there's PACU, there's OR, there's ED, there's MICU. Wait, what's PICU? Pediatric ICU? And then NICU is neonatal ICU. Or there's another NICU, the neuro ICU. You know what I mean? If you even want to go into psych, go into psych nursing. Or if you want psych but you want a little pizzazz, go to psych ED nursing. Like, there are so many branches of nursing that you can go into. So just hop around and see what fits, because something's probably gonna fit. Like, something's gonna fit. You worked so hard to get your license for a reason, so see what you like. So the next one is a little personal. I don't really like meds. I'm gonna be honest, I do not like medication. And by medication, I mean like stacks and stacks and stacks of pills. Like, I am not feeling it. Yeah, when I got out of nursing school, my first job was emergency department. It was a level 1 trauma center, and it was great. It was awesome. I really liked my job, and I chose emergency room specifically because 1, teamwork, and 2, skills. I'm more into the skilled factor of nursing. Like, I much rather do compressions 5 times in a day than give out like 50 pills and split it amongst like 7 patients in the hospital. So yeah, I like skills. I love, doing IVs. I love assisting with intubations. I love nursing assessments, seeing what's wrong with the patient before the doctor even sees them. Like, those are the parts of nursing that I like. And you need to know your meds, though. I'm not saying like you don't need to know meds. When you are doing an assessment, you have to automatically think, okay, so maybe I could use this medication, or I could use this medication if this patient has this. What tests does the patient need to do? I like that type of thing. It's like puzzle pieces. That's what I like to do. I like the puzzle pieces of it all. It's really fun. Honestly, guys, it's really fun. All right, so my next one is, I feel like nurses who have a little bit of anxiety are really good too. I'm just saying, I feel like a lot of people, they be hating on the nurses who have their notepads out and who do all their stuff, but in all actuality, and these tend to be newer nurses too, which is fine. What I'm really trying to say is that those are the nurses that are going to make sure that they do not make any mistakes. And like I said before, I don't really like medication, but if I have a lot of medication, I go over my meds like 1,001 times, because those 5 rights that you learned in school, they carry you forever. Okay, so the 5 rights, a little refresher, is right patient, right time, right dose, right route, and right drug. Okay, make sure that all of those things are correct and go through it multiple times before administering to your patient. Another one is that when you're working in the hospital, or really anywhere as a nurse, from my experience so far and the experience of the people that I know, staffing sucks. I'm a New York nurse, and the staffing is not always the best. And it makes sense, I'm not flagging anybody for it, but if you feel like you're in an unsafe situation, sign the paper, please. Okay? Sign the protest of assignment. Sign it. It's not saying that you're not going to do your job. You're going to do your job, and you're going to do it to the best of your ability. But if something crazy happens with one patient, and then something crazy happens with another patient, but you can't handle both of those patients at the same time because you're just one person and there's no more staff on the unit, what are you gonna do? You know what I mean? At the end of the day, sign that protest paper. It'll save you. It will save you. It will save you. It will save you. It will save you. Sign the protest of assignment paper. It's supposed to get the facilities to hire more people, but like, have they though? I don't know. I don't know. All I know is that I keep seeing people getting hired and hired and hired, but it still feels like no one's here. Like, I'm confused. Tell me in the comments if you guys feel the same way, because like, what's going on with that? I don't know. All right, so this is gonna be my last one. All right, guys, I need all of you to make sure that you keep work at work. When you step out of the unit, you free yourself from the things that happen back there. From my experience, it can be very emotionally draining, right? And mentally draining. Basically, any type of specialty that you work in, you're pretty much working with sick patients to a certain extent or a certain degree. And honestly, this doesn't even just have to do with nursing. This also has to do with just working in general. Leave work at work. Leave work at work, because the more you hold on to these things, the more it's going to mess with your head, and you're going to get burnt out quicker. And it's not necessary, because again, guys, this is a job. We have to show up 100%, do our best, go home, and pass it on to the next shift, because nursing specifically is a 24-hour job. Just keep that in mind, because I know so many nurses who, do not keep work at work, and they get so emotionally burned, like emotionally burned out, and they just get upset and angry and pissed off, or they get really sad and depressed. And it's like, guys, like, you need to find yourself an outlet. I've gotten really good at being professional and compartmentalizing my emotions. And once you work in a level 1 trauma center, in the emergency department, you can handle pretty much anything. I'm a New York nurse, so we saw crazy stuff. And you know what? If you guys want to hear any stories about that, you could just comment down below and I'll totally make a video about it in the future. But yeah, so these are my hot takes. These are my opinions that nobody wants to tell you when you're working, okay? So I hope that you guys like the video, and I'll see you in the next one. Bye.